Hepatitis C, often dubbed the silent virus, is notorious for causing minimal symptoms in its early stages, making it difficult to detect until significant liver damage occurs. However, advancements in medical knowledge and technology have improved early detection strategies, making it crucial to recognize subtle signs and seek timely medical intervention. The silent nature of hepatitis C. Hepatitis C is a viral infection that primarily affects the liver, causing inflammation and, over time, can lead to serious liver conditions like cirrhosis or liver cancer. It spreads through contact with infected blood, commonly through intravenous drug use, unsanitary medical procedures, or contaminated blood transfusions. The challenge with hepatitis C is that most people infected with the virus don't show any symptoms for years, allowing it to progress unnoticed. This is why the virus is often called a silent killer. In fact, only about 20 to 30% of people with acute hepatitis C will exhibit noticeable symptoms. Therefore, routine screening is essential, especially for high-risk individuals, and can save lives by detecting the virus early before irreversible damage occurs. Early warning signs: fatigue and weakness. One of the most commonly reported early symptoms of hepatitis C is an overwhelming sense of fatigue, which can persist even with adequate rest. This fatigue is not typical tiredness but more of a deep exhaustion that may affect daily functioning and overall energy levels. The body's immune system is constantly fighting the virus, which results in energy depletion. Along with fatigue, individuals might experience muscle weakness or general malaise, feeling as though their body is working harder than usual to complete everyday tasks. While many people dismiss these signs as work stress or aging, it is critical to consider that they could be an early indication of hepatitis C, particularly in individuals with risk factors. Flu-like symptoms: fever and body aches. During the initial stages of hepatitis C, some individuals may experience flu-like symptoms such as fever, body aches, or chills. These symptoms are due to the body's immune response as it tries to combat the virus. Though these signs resemble common flu, their persistence beyond the normal flu duration can be an important clue. Patients may also feel muscle soreness or joint pain, which can be sporadic and come in waves. The challenge here is that since these symptoms are so generic, they often go unrecognized as part of a more serious condition. In 2024, healthcare providers stress the importance of not overlooking flu-like symptoms, especially when they persist or appear alongside other subtle signs of liver issues. Abdominal pain and discomfort. Pain or discomfort in the upper right side of the abdomen is a common early warning sign of hepatitis C, as this is where the liver is located. The liver, when inflamed, may cause the area to feel tender or even painful when pressed. The pain might not be constant but could increase after eating or engaging in physical activity. Some individuals describe it as a dull ache, while others report sharp, intermittent pain. This discomfort can be mistaken for gastrointestinal issues, leading people to ignore it or treat it with over-the-counter remedies. However, liver-specific pain should always prompt a visit to a healthcare provider, as early intervention can prevent the virus from causing more severe liver damage. Changes in appetite and weight loss. Another early sign of hepatitis C is an unexplained loss of appetite, which can sometimes be accompanied by significant weight loss. Individuals with hepatitis may find themselves skipping meals or feeling full after eating small amounts of food. This can be due to inflammation in the liver, which disrupts the body's normal digestion and nutrient absorption. Over time, this reduced appetite can lead to unintentional weight loss, which should be a red flag, particularly if no other lifestyle factors, such as increased exercise or dieting, can explain it. The liver plays a crucial role in metabolism, and when it's not functioning properly, it impacts the entire digestive system, causing these changes. Nausea and vomiting. Nausea is one of the earliest symptoms of liver problems, and hepatitis C is no exception. The virus can cause persistent nausea, making individuals feel queasy, especially after eating fatty or rich foods. Some may even experience frequent bouts of vomiting, though this is less common. This nausea occurs because the liver, compromised by the virus, struggles to process and filter out toxins, leading to gastrointestinal distress. While nausea is a symptom of many conditions, its persistence, especially when combined with other signs like fatigue and abdominal discomfort, should prompt further investigation for liver issues. Jaundice, yellowing of the skin and eyes. As hepatitis C progresses, one of the more visible and alarming signs is jaundice, which manifests as a yellowing of the skin and the whites of the eyes. This happens when the liver is no longer able to effectively filter bilirubin, a yellow pigment produced by the breakdown of red blood cells. When bilirubin builds up in the blood, it causes the skin and eyes to take on a yellow hue. Jaundice is often a sign of more advanced liver damage, but in some cases, it can appear in the early stages of hepatitis C. It's essential to seek medical attention immediately if jaundice is noticed, as it indicates that the liver is struggling to perform its vital functions. Dark urine and pale stools. Changes in the color of urine and stool are another sign that something may be wrong with the liver. Dark, amber-colored urine can indicate an increase in bilirubin in the body, while pale or clay-colored stools suggest that bile production or flow from the liver is blocked or impaired. These changes are often subtle at first, but can become more pronounced as the virus progresses. Dark urine, in particular, should not be ignored, especially if accompanied by other symptoms like jaundice or abdominal discomfort. Pale stools can also point to digestive system disruptions caused by liver inflammation. Itchy skin and rashes. When the liver is not functioning correctly, toxins that should be filtered out begin to build up in the body, which can cause itchy skin or rashes. The itching can range from mild to severe and is often worse at night. While many people may dismiss itchy skin as a minor issue, in the context of other hepatitis C symptoms, it could indicate that the liver is having trouble eliminating waste products. This buildup of toxins in the bloodstream is called pruritus, and it can cause severe discomfort. It's important to pay attention to persistent itching, especially if it occurs without an obvious cause. Advanced screening and diagnosis. The push for early detection of hepatitis C has led to more accessible and reliable screening tools. The Centers for Disease Control and Prevention recommends that all adults, particularly those between the ages of 18 and 79, be screened for hepatitis C at least once in their lifetime. High-risk individuals, such as those with a history of intravenous drug use or people who have received blood transfusions before 1992, should be tested more regularly. Modern screening involves two primary tests: the hepatitis C antibody test, which determines if the person has ever been exposed to the virus, and the HCV-RNA test, which checks for active infection. These tests are quick, accurate, and widely available. Modern treatment options. The treatment landscape for hepatitis C has evolved significantly in recent years. Direct-acting antivirals remain the gold standard, offering high cure rates of over 95% for most people, with minimal side effects. Unlike older treatments that required months of injections and caused debilitating side effects, direct-acting antivirals are oral medications that typically need to be taken for 8 to 12 weeks. They work by targeting specific proteins the virus needs to replicate, effectively stopping the infection in its tracks. Pan-genotypic treatments are now more common, meaning that a single treatment can work for all known genotypes of the virus. Thanks for watching our video on how to detect early signs of hepatitis C. If you found this information helpful and want to stay updated on more health topics, don't forget to hit that like button and subscribe to our channel. Stay informed, stay healthy, and we'll see you in the next video.